Lymphatic filariasis is caused by a parasitic infection of nematodes such as roundworms or threadworms from the Filariidae family. There are 3 types of parasitic roundworms that cause this infection. The female nematodes are 10 centimeters long and 0.2 millimeters wide, while the males are only about 4 centimeters long. The adults reside in the lymphatic system where they produce up to 50,000 microfilaria per day. The microfilarias are 250 to 300 micrometers long and 8 micrometers wide and circulate the peripheral bloodstream.
Adult worms take 6 to 12 months to develop from a larval stage to live in between 4 to 6 years. Patients still remain asymptomatic even when infected. Mosquitoes are infected with the microfilaria when ingesting blood from an infected host. When the infected mosquitoes bite a human, the blood then is left on the skin surface and thus now can enter the body. The larvae then migrate into the lymphatic vessels where they mature into fully grown worms and then produce microfilaria, and the cycle continues.
Nematodes are the sources of lymphatic filariasis, a disease also known as lymphatic. These nematodes are roundworms that develop from larvae after a duration of time inside the host. There are 3 types of these roundworms: the Brachia timori, Brachia malai, and Wuchereria branchofti. These nematodes have the ability to grow fully within a period of 6 to 8 years inside the human body. During this growth, they produce enormous amounts of microfilaria. Microfilaria is a type of an immature larva that circulates around the body within the blood. Mosquitoes, which are parasitic flies, are a main reason for the spread of lymphatic filariasis. They bite and suck blood. When mosquitoes bite a person suffering from lymphatic, it gets infected and the microfilaria gets transferred to the body of the mosquito. The microfilaria then mature into a larva inside the mosquito. When an infected mosquito then bites and sucks blood from a healthy person, its larva is deposited to the spot where there is a bite. The larva then travels through the lymph vessels and then eventually matures into an adult worm. The worm then disrupts the function of the lymphatic system, causing elephantiasis.
Lymphatic filariasis is transmitted from person to person through bites by an infected mosquito. It is spread by different types of mosquitoes such as Culex mosquito, which is prevalent in the urban and semi-urban areas. And Aedes mosquito is very common in tropical and subtropical areas. These mosquitoes are infected with microfilaria when they are ingesting blood during their blood meal on an infected host. When an infected mosquito bites people, mature parasite larvae penetrate through the skin to the lymphatic vessels where they form adult worms and therefore proceeding the cycle of transmission.
According to the clinical incubation, the period is about 8 to 16 months. Microfilaria may survive for 15 years or more in the lymphatic system of a human. The female worm, viviparous, give birth to about 50,000 immature microfilaria per day after mating, which may live for 1 or more years. Some microfilaria are ingested by the mosquito during their blood meal.
It is estimated that more than 1.3 billion people in 72 countries worldwide are at risk of lymphatic filariasis, and 30% of them live in Africa. Of the 30% that is infected with the disease, 40 million are incapacitated or disfigured by the disease. In endemic communities, it is estimated that 10 to 50% of men and up to 10% of women can be infected with lymphatic filariasis. Due to the psychological and social stigma associated with lymphatic filariasis, people living with the disease have a poor quality of life and are often unable to work or be active members of their communities. While effective, the medications can cause severe side effects in up to 70% of patients as a result of either the drug itself or the massive death of parasites in the blood. The outlook is good in early or mild cases, especially if the patient can avoid being infected again. The disease is rarely fatal, and with continued World Health Organization medical intervention, even gross elephantiasis is now becoming rare.
The infection involves asymptomatic, acute and chronic conditions. The asymptomatic infection still causes damage to the lymphatic system and kidneys. A small percentage of infected persons will develop lymphedema, which mostly affect legs but may also affect arms, breasts, and genitalia. The reduced lymph system's ability to fight infections results in a more bacterial infection in the skin and the lymph system, resulting in hardening and thickening of skin tissue and the limbs. Men may develop hydrocele. Among the inhabitants of Asia, they may have tropical pulmonary eosinophilia syndrome, symptoms of which include cough, shortness of breath, wheezing.
Filariasis is treated using mass drug administration of anti-parasite drugs. This implies that the medication is given to the population without testing for the infection due to the disease being endemic on that particular population. Mass drug administration anti-parasitic drugs in the human body works by preventing the vector-borne transmission by killing the macrophyllaria and inducing sterilization of adult worms. However, the adult worms continue to be in the human body. As a result, prolonged use of the treatment is necessary to ensure that the patient is properly healed. Surgical excision is used to manage large hydrocele and scrotal elephantiasis. In the continent of Africa, only a few can afford surgical excision due to the higher medical costs that they have to pay. The treatment that is available is albendazole, given to adults and children over 10 kilograms, 400 milligrams per dose, and children over 6 months but less than 10 kilograms, 200 milligrams per dose, and diethylcarbamazine, given 6 milligrams per kilogram. The side effects of the medication after 24 hours include chills, fever, and muscle pain. And the side effects for prolonged use include tunnel vision and night blindness. The following preventative methods may be taken into consideration when living in a prevalent area. Usage of insect repellent and mosquito nets. Wearing long-sleeve shirts and long pants. Mosquito control through the usage of pesticides and vaccinate human beings. Currently, filarial glutathione S-transferase is being researched as a future vaccine for lymphatic filariasis.